Welcome everyone. This is a follow-up questions that we received from our audience back in the webinar Mapping Value for Many on Precision Medicine, hosted by HITAP Thailand and the Swasri Hawk School of Public Health, National University of Singapore, and featured by our guest lecturer, Assistant Professor Wen Jie Shen, on 22nd of June 2023. And these are the answers to your questions. Methodological challenges with economic evaluation of precision medicine. When conducting a health technology assessment study that compares precision medicine to standard treatments, what specific considerations should be taken into account when determining the input parameters for constructing the HTA model?
Well, thank you for this question. There are actually many methodological challenges and recommendations in constructing an HTA model for precision medicine. We have even published a paper just to summarize the challenges, and which is recently published in Value in Health. But long story short, one thing we need to keep in mind that the model should be designed in a way that it can derive the incremental effectiveness and, of course, and cost of individualized care that are enabled by the precision medicine in a consistent and unbiased manner. And we are currently developing a methodology reference case to standardize the conduct and report of economic evaluation specific for precision medicine across different developmental stages. And hopefully this will be helping the researchers in considering the input parameters for the HTA model of PM. And we will share with you the results once it's finalized, piloted, and published.
In your expert opinion, do you believe it is appropriate to utilize a healthcare perspective in the evaluation of precision medicine interventions? Could you elaborate on this, including the challenges associated with using a societal perspective?
Although ACE Singapore recommends to use a healthcare systems perspective, and it does not require a societal perspective, yet for the long term and in particular the intergenerational effect that can the precision medicine bring forth to the population, sometimes it's the use of societal perspective can more comprehensively capture such benefits, such as the human capital gains and work productivity gains. So I would say a societal perspective may be more comprehensively capturing the effect of precision medicine that extends beyond the current period of treatment, compared to a healthcare systems perspective. But of course, the use of a societal perspective is associated with its unique challenges. For example, it's sometimes difficult to capture these type of a productivity gains, or even it may not be even relevant for some target population of the PM intervention, such as the critically ill patients with late-stage cancer. And many PM studies, they are actually small pragmatic trials, which means that it's more difficult to measure productivity loss directly.
Considering the countries have varied approaches to adopting thresholds for cost effectiveness, such as Thailand's deviation from the one-time per capita GDP per QALY, could you kindly explain whether your study results and conclusions would remain consistent when using different threshold references, whether lower or higher CET values?
Yes, if we use a different cost effectiveness threshold value, that may cause a slight variation of our results than what is currently we decided to use the one-time per capita GDP as the like willingness to pay threshold, so that we can relate the value for money of PM to each country's unique country income capacity. And this is actually recommended by WHO for low to middle income countries. But this is not a recommendation that we will make for researchers to conduct cost effectiveness analysis. It is just for the ease of conducting meta-analysis on this specific topic, which is usually adopted by different cost effectiveness analysis of the different meta-analysis of cost effectiveness studies.
How would you address the significant uncertainty surrounding the incremental effectiveness derived from early EE or early economy evaluation results in meta-analysis and meta-regression analysis?
Yeah, in our reference case, we also have made specific recommendations for handling early stage economic evaluation. But how to address for uncertainty in early economic evaluation is a case by case, we need case by case solutions. But in general, the best strategy is, of course, to use reliable data. But in the absence of reliable data, we need to rely on an approach that require less intensive assumptions. And one can apply like comprehensive sensitivity analysis, scenario analysis, and so forth to examine the influence of uncertainty. So it may be difficult to control for uncertainty, but there are different approaches to examine the influence of uncertainty on the results. So to know better the uncertainty, to reduce the uncertainty in the findings. And also there are new like advanced approaches that can rely on less or fewer number of assumptions. And we can also use reference case to present the results to increase the comparability of results between studies. Yeah.